Features of metabolic syndrome: A. Central obesity, B. Hypertriglyceridemia, C. Insulin resistance, D. All of the above. Correct answer D. All of the above. Metabolic syndrome is also known as Raven syndrome and syndrome X. Hypertension and low HDL are the other associations. There is another syndrome X, which is angina with normal epicardial coronaries. Ebstein's anomaly is seen with A. Aortic valve, B. Mitral valve, C. Tricuspid valve, D. Pulmonary valve. Correct answer C. Tricuspid valve. Ebstein's anomaly is the distal displacement of the septal and posterior leaflets of the tricuspid valve. The anterior leaflet is normally attached and is hence much larger than the other leaflets. Closure of the large anterior leaflet produces the loud tricuspid component of first heart sound in Ebstein's anomaly, known as sail sound. First drug to be given to a person with suspected acute coronary syndrome: A. Heparin, B. Tirofiban, C. Aspirin, D. Streptokinase. Correct answer C. Aspirin. Aspirin is the first drug to be given to a person with suspected acute coronary syndrome in the emergency department. First dose should be chewed to facilitate buccal absorption and early onset of action. Wrong statement about natriuretic peptides. A. Secreted by ventricular myocytes in response to stretch. B. Anti-proBNP has a shorter half-life. C. Anti-proBNP levels reflect the mean values of left ventricular filling pressures over the previous 12 hours. D. BNP has vasodilative, diuretic and natriuretic activity. Correct answer B. Anti-proBNP has a shorter half-life. Brain natriuretic peptide is secreted by ventricular myocardium in response to stretching of cardiomyocytes. BNP has vasodilative, diuretic and natriuretic activity and is a sensitive marker of left ventricular end-diastolic pressure. ProBNP is the precursor of BNP, which is enzymatically cleaved into an inactive amino-terminal fragment known as anti-proBNP and a biologically active carboxyl terminal fragment called BNP. Anti-proBNP has a longer half-life, 1 to 2 hours versus 22 minutes compared to BNP. Hence, levels of anti-proBNP are more stable and less influenced by acute hemodynamic variations than BNP levels. For this reason, anti-proBNP levels reflect the mean values of left ventricular filling pressures over the previous 12 hours. All of the following are true about PCSK9 except A. Secreted into plasma by kidney, B. Binds LDL receptor at the surface of liver cells, C. Prevents recycling of LDL receptors, D. Results in reduced LDL cholesterol clearance. Correct answer A. Secreted into plasma by kidney. PCSK9 is secreted into plasma by liver and not the kidney. Binding of PCSK9 to LDL receptors on hepatocytes enhances degradation of the LDL receptors by endosomes. This in turn leads to reduced LDL clearance. Inhibition of PCSK9 with monoclonal antibodies reduce atherosclerosis and cardiovascular events. Which of the following is an antidote for dabigatran? A. Abciximab, B. Idarucizumab, C. Infliximab, D. None of the above. Correct answer B. Idarucizumab. Abciximab is a glycoprotein 2b3 antagonist and infliximab is a TNF-alpha antagonist used in the treatment of autoimmune disorders. Best option for prosthetic valve thrombosis presenting with stroke: A. Thrombolysis, B. Intravenous heparin, C. Subcutaneous heparin, D. Surgery. Correct answer D. Surgery. In patients presenting with stroke, surgery is the first option as thrombolysis is contraindicated. Surgical treatment has a combined risk of death or stroke of 9%. For prosthetic valve thrombosis without stroke, if the thrombus in the prosthetic valve is less than 5 mm in size, only intravenous heparin is recommended. For larger thrombi, there are two options: thrombolysis versus surgical treatment. Thrombolysis has an initial success rate of 70 to 80%, but there is a 5 to 22% risk of embolism and 5 to 12% risk of disabling stroke. Thrombolysis is the preferred treatment for right-sided prosthetic valve thrombosis and small left-sided thrombi. Which of the following is not a feature of hyperkalemia on ECG? A. Prolonged QT interval. B. Tall peak T waves. C. Sine wave pattern. D. Atrial paralysis. Correct answer A. Prolonged QT interval. Prolonged QT interval does not occur in hyperkalemia. It is a feature of hypokalemia. Tall peak T waves, widening of QRS with merging of QRS with the beginning of the T wave, sine wave pattern, and atrial paralysis with sinoventricular conduction are features of hyperkalemia. Location of atherosclerotic plaques in relation to myocardial bridge. A. 20 to 30 mm proximal to the myocardial bridge. B. Within the myocardial bridge. C. Distal to the myocardial bridge. D. None of the above. Correct answer A. 20 to 30 mm proximal to the myocardial bridge. Reversal of systolic flow from the bridge segment has been noted on Doppler tracing. In the coronary segment proximal to the bridge, the retrograde flow collides with the antegrade flow, causing high systolic wall shear stress. This is thought to be the reason for coronary plaques about 20 to 30 mm upstream of the myocardial bridge. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.